Um, my name is Andrea Bonino, and I am a social work supervisor for the social workers in the restoration department here. Um, I've been here about 6 years. I've been in the mental health system for many, many years. So I've seen a lot of changes. And so, one thing I'd like to discuss is what is going well in our restoration program. Um, so, first of all, we have six. We have 5 restoration units, and one just opened as an all female restoration unit. So I think that's vitally important because I think our female population is underserved. By that, not just in restoration, but mental health as a whole. And so, one thing I think is going well is our treatment. We have a good program and we provide treatment to the patients based on their level of need. The challenge to that, though, is as you know, the patients commit crimes, they go to jail, they're ill, it takes a while for them to get here. Last I heard, there was 185 on our waiting list. Um, they get here and they're very sick, so in order for them to get to the place where they can get restoration treatment, they have to be medicated. Sometimes emergency meds and voluntary meds. Sometimes they're transferred or progressed a little bit sooner than they should be. So sometimes it takes a while for them to get into treatment. So that has been a challenge. Um, but I think that our treatment program is effective in that we teach them the legal system. I'm sorry, I'm Italian, I have to talk with my hands. Basic legal knowledge. Who is the judge? Who is the attorney, the public defender? And then we also help them understand what their police report says and what their crimes are, what they're being charged for. And then we help them develop some awareness of how to proceed with their attorney and the court system. So I think that that's been a good thing within our system. Let's see. And we are also opening a new bed, you probably know, a 39 bed unit in December for restoration. So as I talked about the challenge, it has been a challenge, as you know, to get the patients here. In addition to that, it's been a challenge to get the patients discharged, and you probably will hear that a couple times today. So we stabilize our patients, we restore them. Sometimes they go back to jail, and within the jail system, I think discharging them has been difficulty. Here, if our patients are deemed unable to be restored, we look for placement, and it's very difficult to find placement in the community for our patients. Not only are they criminals, they're mentally ill. If they have sex offender issues, that's 5 times as difficult. And then it kind of depends on their history here, because when people are sick and they're paranoid and they act out, sometimes they assault, and so then they get other charges. So the legal aspect and the mental health treatment has been challenging when we're trying to get our patients out of here. What I'd like to see happen, and my suggestions are, of course, I'm a social worker, and I'd like to see more social work positions, because I think the social workers are an important, if not the most important part of the discharge planning, because not only do we find a placement, we provide the services, we do the benefits, and we do have a benefits specialist. I believe he might be up next, but I'd also like to see more positions for that benefits specialist, because the paperwork has been a challenge. And so I think that if we had more of those types of positions, we could work together differently and better, so that we can get those benefits sooner and get the patients out of here quicker. Along with that, it would be helpful if the mental health centers within our communities helped us with those resources as far as finding placements and getting them into the mental health system quicker for treatment once they discharge, because we do see some recidivism.
Andrea, you have about 1 minute.
1 minute? Okay. Thank you for that. And since the trend is restoration treatment, what I would like to see is more beds here, more units here, more treatment here. Gosh, it's horrible getting old.
At least you're wearing glasses. There are people at this table who need them that don't.
You know what? I'm Italian and I talk with my hands too, so just
One last thing that I would like to see happen within our behavioral health system is we need to educate the legal system. And by that, I mean attorneys, judges, and people who don't really understand what we're doing here, how we're doing it. For example, a guy gets arrested, he is paranoid, he